Welcome. This is the Dentist News Network. I'm Scott Drake with my guest, Dr. Glen Doyon, with the Center for Microsurgical Endodontics in Scottsdale. Dr. Doyon, it's a pleasure. Welcome.
Hi, Scott. How you doing?
I guess we should start out with the most obvious question. I'm sure some people don't know what endodontics is. What is it?
That's a great question, and you're right, Scott. A lot of people don't know what I do. It's a real stopper at social gatherings. An endodontist is a root canal specialist, and a root canal specialist is someone who specializes in dealing with the diseases of the pulp, and that's the inner part of a tooth. It's actually the neurovascular system, the nerves and blood vessels, if you will, of a tooth. And they're there because when you're born, you know, Scott, you're born without permanent teeth, and through development, the specialized cells make a tooth around them, and then when they're done doing this job of making a tooth, they're done their job, and they sit inside your tooth and do nothing but cause trouble and give me a job. But they are there, a remnant of development that sometimes needs to be treated, and an endodontist treats those tissues.
Glen, can you talk about some of the new technology that you're using and seeing?
Well, there's a couple of major developments in the field of endodontics, Scott. Both having to do with providing our care just a great deal more accurately and more predictably. First major recent innovation in endodontics is increased vision, ability to see what we're doing. When we're working inside a tooth, in dentistry in general, we're working in a very small space. Everything matters in small dimensions. We're working in millimeters or less. And for the last 15 years or so, very slowly but surely, microscopes are becoming a part of everyday care. I haven't treated a tooth without using a microscope for the last 7 years. And I can't imagine ever going back to providing care without one. There's no way I could do as good a job as I do today. The advent of microscopy in endodontics it's just like the advent of having microscopes in brain surgery and in ophthalmic surgery. What we're doing just requires that kind of vision, that kind of acuity, that kind of ability to see what we're doing. So I've put that at the top of my list as one of the best breakthroughs in endodontics, and in dentistry, having increased vision is just so key.
And I guess some really new technology is cone beam imaging, and you're one of the few endodontists in the area who have it and use it. Can you explain what it is?
Yeah, sure, Scott. It's not a microscope. Cone beam is a X-ray. It's a projection of X radiation for doing a kind of particular image of a tooth. So the cone beam is a cone, and it's a beam from X-rays, and the X-ray unit generates X-rays. The patient is exposed, and a computer processes that information and renders a 3D image of a tooth. And depending on the model that's available, my model, for example, takes a slice in 76 micron sections. What that means is I can look at a tooth in 3 dimensions, vertically, horizontally, back and forth through the tooth, and across the tooth in less than a millimeter slices, so I can see multiple views of the tooth. It is use the euphemism, greatest thing since sliced bread in dentistry. It's revolutionized what I do. I know there's just a couple offices in the Valley that have one, and I think probably in 15 years, even general dentists will have cone beams or some kind of 3-dimensional X-ray imaging device in their offices. It's beyond spectacular. You can take a look at this image that I'm looking at right here of a patient that we just saw, and you can see how I can look at this tooth through multiple layers, looking at the inner workings of the tooth, if you will. I can see this tooth in 3 dimensions before I begin to treat it. And this is as opposed to the X-ray that we've been so happy with for the last 100 years, just a 2-dimensional image of superimposed information. Now I have it, rather than having to imagine that tooth in my head, I can imagine it in reality. I can see it in reality in 3D in its exact size.
My guest has been Dr. Glen Doyon with the Center for Microsurgical Endodontics in Scottsdale. Dr. Doyon, thank you.
It's been my pleasure. Thanks a lot.
And you're watching the Dentist News Network.